Welcome to the Chamber Chat Live podcast. I hope you'll find it both informational and entertaining. Hi, I'm Carol Knight with the Encinitas Chamber of Commerce, and welcome to Chamber Chat Live. Vertigo, dizziness, and balance-related conditions are among the most common health-related problems in adults. Nearly 40% of U.S. adults have experienced vertigo at least once in their lifetime. I'm included in that, with women more susceptible than men. 40%, that's a big number. To help unravel the mystery of vertigo and related conditions, I'm honored to have with me today the Vertigo Detective, Dr. Kim Bell. Welcome.
Thank you, Carol. I'm pleased to be here.
So we have a lot to cover today. I have a lot of questions for you, so hopefully you can shed some insight into that. But let's get a little bit about your background. How did you get into practicing medicine?
So I'm actually a doctor of physical therapy. I'm not a medical doctor, to be clear, so I don't prescribe medications. I do exercises and maneuvers and different treatments within the profession of physical therapy to assess and resolve dizziness and vertigo. I always knew from the time I was very, very young that I wanted to be a doctor. In fact, my dad used to sit me down and say, I want you to be a doctor when you get older so you can take care of me when you're an old man, when I'm an old man. And so it was sort of drilled into my head from a very young age that I was going to be a doctor. And I thought initially I would be a medical doctor. Mm-hmm. And when I entered college, my major was pre-med. But my father passed away the first month I was at college, and so that sort of rocked my whole world. Of course, it's a life-changing event. It caused me to really reevaluate what I wanted to do now that I didn't have that pressure on me anymore to take care of my dad when he got older because he was no longer with us. And so I switched my major to social work, believe it or not, mm-hmm. because I always had a heart for people, mm-hmm. and I wanted to help people.
Right.
And then I realized that that wasn't quite right either because I was really into exercise and fitness, and I was an athlete at the time at the college level. And so I realized physical therapy was kind of a great mix. It was sort of like being a doctor and a social worker, right, and doing exercise, mm-hmm. as the primary intervention with people that need help. So it was sort of a perfect middle ground for me. And then I did initially enter the profession with a master's degree in 2002. But as soon as I graduated from school, from University of Maryland, Baltimore, the whole profession switched to the doctorate level. So within the first year after I graduated with my master's and entered the profession as a licensed physical therapist, all of a sudden my degree was obsolete.
Oh, so you had to go
So then
back?
I went back to school while I was working full time and got my doctorate as well. Yeah.
So how did you hone in on this particular area of vertigo?
When I relocated to San Diego in 2005 from Baltimore, Maryland, one of the first jobs that I took here, I took a couple per diem jobs, and then I sort of got a salary quote from all of them to see what it would be going full time. So I had a little bidding war with my first full-time job here.
Not everyone can say that.
Yeah,
That's good
so
for you.
that's good about being a physical therapist. You can pretty much get a job anywhere you move. And so the first full-time job I took here, I started there in February of 2006. And the very first day on the job, they sent me to a course to train on how to treat dizziness and vertigo. It was actually taught by the director of the program where I worked. So she taught all the new employees how to treat vertigo. And it was a big program here in San Diego. We made house calls all over the county for homebound older adults. Mm-hmm. And we specifically treated dizziness and vertigo with physical therapy. So it was not planned. It just sort of happened that the employer I got the full-time job here sent me to the training, and I loved it. After I took the course and I started treating patients, I thought, this is incredible. People that have been debilitated for 20 years with dizziness, unable to drive, their whole life is on hold, mm-hmm. and then I do a handful of physical therapy visits with them, and all of a sudden they've got their life back. Mm-hmm. It was just so real,
right.
And it was amazing, the impact it made on people. So I quickly got really hooked on it, and I got promoted from a staff physical therapist to become the team leader fairly shortly after that. So I did 50% patient care and then 50% training and mentoring the new staff members and ensuring the quality mm-hmm. of care was consistent throughout the whole program, because we had about 30 physical therapists doing this across the whole county at that time. And then when my director left, she took another job. I got promoted to the director's position. So I did that for about 3 years, I believe. I was the director of the whole program.
Wow, your path was a quick trajectory.
Yes,
huh?
it was. So it was both, I would say clinical excellence, really pursuing excellence in this clinical area, plus a lot of enthusiasm on a personal level, just loving it. And so I had the privilege of sort of overseeing the training, mentoring, and quality of care of a team of physical therapists who covered the whole county of San Diego. They were all homebound older adults that we treated with dizziness or vertigo, and we were able to, help them improve their quality of life, help them stop falling. It's a big problem with older people. And so my real introduction into this niche of physical therapy was in older adults, in home health physical therapy.
So let's dial it back a little bit. What is vertigo? For those who may not, I count myself in that 40%. I've had vertigo, and both my mother and sister are prone to it. So explain a little bit about what vertigo is.
Yeah. Well, your comment is interesting because vertigo can have a genetic component. So when you say my mother, my sister, and I would say for you there is probably a genetic component. So it's good to know so that you can educate other people, especially women in your family about it, right? So they know what it is and they know what to do. So vertigo is defined as a sensation of movement. Usually it's a spinning feeling, it can be a sliding feeling, or a tilting feeling when you're not actually moving. So it's an illusion of movement. There is always a movement component when you're either, so it's either a misunderstanding of normal motion. So say you roll over in your bed and you're just rolling onto your right side, but all of a sudden you feel like you're rolling down a hill in a barrel, okay? Or you're doing a cartwheel into the bed. So it's a misperception of otherwise normal motion, or you can be completely still. So I'm just sitting here and all of a sudden I feel like I'm tumbling backwards or tumbling sideways. So it can also be a perception of motion when you're completely still. And you can feel it when you're lying down, you can feel it when you're sitting, you can feel it when you're standing up. It can hit you kind of at any time, in any position, or with any movement. And typically, in most cases, it lasts for less than a minute, but there are some diagnoses and root causes that can cause it to last for 20 minutes, hours, even days.
You're making me nauseous talking about it. It brings it all back to me.
Yeah, it's pretty awful.
All right, so I know, just so you know, I know vertigo adjacent information. So there's positional vertigo. Is that what you're talking about? It depends on what position you're in?
Yes.
Okay.
And those are the ones, exactly. So there's positional vertigo, meaning when I move my head in a certain way or I move my body in a certain way, I feel the vertigo. I feel the spinning. I feel the tilting. I feel the sliding. So whatever the individual's perception of false motion is, it's in positional vertigo, it's typically triggered by certain motions or certain positions. Yes.
Okay. So it can then be extremely debilitating if that's how you're feeling,
Yes.
whether it's a minute, 20 minutes, or 2 days.
Exactly. Yeah. And I want to be clear, there's also other types of vertigo. There's spontaneous vertigo, where you didn't move and you didn't turn or do anything. It's not positional, it's spontaneous. And it's just typically in that case continuous with unrelenting. And those are people that usually end up in the emergency room. So, but yeah, it's absolutely debilitating. I mean, most patients I work with are at a point where they're saying, am I going to die from this, right? Who's going to take care of my kids? Will I be able to see my kids grow up? What is wrong with me? Because, a lot of times they've gone through the whole healthcare system. They've gotten the brain scans, all the blood work. They've gotten the full workup, maybe even seen multiple specialists by the time I get to work with them, and they have no answers. A lot of times it's, they said I'm fine. My scans look normal, my blood work is normal. They can't figure out why I'm having this. And so that starts the panic, right? And so a lot of patients have then an emotional overlay of panic anxiety, even to the point where they can become depressed or even in some cases suicidal because they can't figure out what's wrong or get relief, and they're having trouble just functioning. You know, getting out of bed to go to the bathroom in the middle of the night and I feel like I'm spinning. Waking up in the morning and I sit up on the edge of my bed and I'm spinning. You know, trying to make my breakfast, trying to slice vegetables, kissing the kids goodnight. You know, there's so many things throughout the day that may cause them to feel the symptoms. And if they don't know the cause, and then they don't know what to do about it.
It's really unsettling.
It's terrible. And so when people have pre-existing mental health issues, obviously they can get triggered, but then even people that have never had a mental health problem in their life can develop situational anxiety and situational depression, and some people even develop like a PTSD kind of an experience where they're actually having like a trauma response to the vertigo if it's extreme.
All right, and so vertigo is the most extreme of dizziness, or does dizziness is a whole different category? Because you differentiate the two.
That's a great question. So most people in the general public lump them together, and they just refer to the whole category as dizziness. And so if you're talking to somebody that doesn't have any education or training or knowledge of this field, they're going to just group it all together as dizziness. And so that's why most of my marketing, and when I talk about it, I usually use the term dizziness because that's what most people call it. But dizziness doesn't actually have a complete medical definition. There's no real medical definition of dizziness. Typically, we're going to think of dizziness as something that's more like lightheaded. Maybe you feel like you're thirsty, you have low blood sugar, you almost feel like you could pass out. That's typically going to be the dizziness. It's a general lightheaded feeling, whereas the vertigo is going to involve the false perception of movement, either the distortion of normal motion or you feel like you're moving when you're not moving. And so that's the difference.
Okay.
But most people group them together in general terms. And so I like to say dizziness or vertigo because someone who doesn't have any background or knowledge is going to call everything dizziness. Someone who has a little more knowledge is going to call it vertigo. And I'm looking to help that whole category of people.
Right.
And then you also have a third category in this general area, which is called disequilibrium, which means you feel off.
Right.
You don't feel centered. You feel like you could fall over. You feel like you lose your balance. You might be bumping into walls, have some near falls where you have to kind of grab onto the table to prevent yourself from falling. And so disequilibrium is part of this area of discomfort as well, where people just feel off balance.
I think that, so my mother, I think I've mentioned this to you before, she feels like, I always call it wonky because she's not quite, it's not vertigo per se. It's not, she doesn't really say she's dizzy, but maybe.
She's probably has disequilibrium.
Right.
Where she just doesn't feel centered.
Right.
She doesn't feel safe. Yeah. She feels like she could fall at any moment. Yeah. And the terms people use are, to me, very interesting. You know, wonky, wobbly, woozy, bobblehead, floating bobblehead. I feel like I'm in a fish bowl. I'm in a cotton ball. I'm in a cloud. I'm behind aquarium glass. I mean, I hear so many different and interesting descriptions, but the reason is because it's really beyond words. You just don't feel good. You don't feel like yourself, and you know something's wrong, and that's why people get confused, frustrated, upset, and they lose hope when they try to seek medical care to relieve it, and they're not getting any answers. And they're being told, you're fine, nothing's wrong with you. And they're going, I know something's wrong with me. I don't feel okay. But the interesting thing about vertigo is you pretty much look totally normal, unless you're green because you're like vomiting, or you're pale because you're about to vomit. So unless the skin changes color, if they get pale or they get green, then it's obvious something is wrong. But other than their skin changing color, most people with vertigo look totally normal. And that's really hard. Because, if they had a cast on their foot and they're walking around with crutches, obviously everyone would be very compassionate and sympathetic towards that. But when you're just sitting there and you look normal and you're going, I don't feel right, something's wrong with me, I'm dizzy, or I have vertigo, it's actually really easy for people to minimize or dismiss that.
Right. All right, so then with the older, does vertigo hit regardless of age, or are adults more susceptible to vertigo?
It's most common in people in their 50s and 60s. Mm-hmm. And in that age group, it's 7 women for every 1 man, mm-hmm. as you previously said. However, I've treated as young as 5 years old now. Mm. So when I left the job I mentioned to you, I started a private practice in 2014 in order to expand so I can treat people of all ages now. And so I do treat people. The youngest patient I've ever had was 5 years old. I've treated a handful of teenagers, and then, people of all ages, all the way up to over 100 years old. But it's most common by far for a spontaneous onset, meaning you didn't do anything to cause it. It just happened out of nowhere with no known cause. It's most common in people in their 50s and 60s, mm-hmm. and very common in perimenopausal women. And then it stays high throughout the lifespan after that due to normal aging of the ears.
Normal aging of the ears. Will you expand on that for me?
Yes. So the most common cause of dizziness and vertigo that's related to the ears is from these crystals that get loose in the ears. I don't know if you've heard of that before, but the technical term is BPPV. So benign paroxysmal positional vertigo. That's the most common thing I treat in my practice, and I'm an expert in treating that. But so that's most common from crystals coming loose in the ears. Okay, so it can happen to young people if they get a concussion, for example. Mm-hmm. So that's what happened to me when I was in first grade. I got 2 concussions in a row, sports related, and then I had off and on dizziness and vertigo for about 25 years. And so it's common in young people if they get a concussion, it can knock the crystals loose, and then they have positional vertigo after that. But due to hormonal changes is one of the things we suspect in women, and then due to normal aging of the ears, as we're getting up there in our 50s and 60s, the area of the ears where the crystals are supposed to be, so they actually have a job, and you have them from the time you're developed in your mother's womb. The crystals are in there, so they're in babies. They're actually in every animal that has a spinal column. So every animal that has a vertebrae, a spinal column, has the crystals in their ears, and they help to sense where you are in space in relation to the pull of gravity.
Okay.
Even like fish,
right.
Like dogs, bears, they all have crystals in their ears. And so when the crystals come loose from where they belong and they travel into these semicircular canals in your ear where they're not supposed to be, it's only supposed to be fluid in there, that's what causes this vertigo. Okay, and so what we have to do is, first of all, identify that that's the problem, because there's other problems that can cause dizziness and vertigo as well. But that is the most common thing that I treat. And then once we figure out that that's the problem, then we have to play what I say is essentially like a biological pinball game with the patient's head to reverse the course of the crystals, to make them backtrack through the ear from whence they came and put them back where they belong. And so it's like a biological pinball game.
Wow.
Yeah.
Well, and this is why they call you the Vertigo Detective.
Yeah, exactly.
I mean, there's a lot of steps to identify what, how, what to do.
Exactly.
Right?
There's a lot. And so so my initial consultation now with patients in my private practice, which is here in Encinitas, and then I do make house calls all over San Diego County if needed. If people are debilitated and they can't get to my office, I have the flexibility to go see them at their home. But the initial consultation, I actually use a set of screening questions before I'll even schedule an appointment. I don't charge anything to review their answers to the screening questions because I want to make sure I'm the right provider for them. For example, if they're reporting that they had a hearing loss at the onset of their vertigo, that's an automatic referral to neurology, and I'm not even going to schedule an appointment with that patient until they've seen a neurologist, because that's potentially, something a bit more serious, right? So that's part of my screening questions. So I have a set of screening questions. Anyone that wants to work with me fills that out. I look through it. If I think they need to see someone else first, I send them to another provider and I don't charge them anything. If I think it fits within my wheelhouse and my specialty as what's called a vestibular physical therapist, so I'm a physical therapist specializing in vertigo, then I'll go ahead and schedule with them. The initial consultation is about 5 hours.
Oh, wow.
Yeah.
Really?
Yeah, with me. And
that's in-person consultation?
So it's about 4 hours in person at my office, including an examination and a treatment in the same session. So they get examined and treated all in the same session. It can last up to 4 hours. And then prior to meeting with them in person, I want to hear their whole story. So that's one of the complaints I hear from a lot of people when they're going through the healthcare system. They feel like no one has time to listen to their whole story. and it makes them feel like nobody cares. And I don't think that's true. I think it's just that clinicians are so busy now, they have to see 20 patients a day. And so they're just hustling the patients through, and they don't have time to hear the whole story, not because they don't care, but it's just our healthcare system is broken right now. And so in my private practice, I don't take insurance. I only do private pay, but that allows me to set aside the time that people really need. So I talk to all my patients on the phone the day before I see them. And usually it's about a 30-minute call. But if they have a long story, it can be an hour, even an hour and a half. Because I want to hear the whole story. I want to know everything that's happened to them from the first time they felt the vertigo up until the present day, all the consultations they've had, the results that they've found, the treatments they've tried, how that's worked or not worked. And I want to hear how this is impacting their life. You know, unfortunately, for some people, it can cause marital problems. It can cause them to have to go on disability with their job. They may have to switch careers because of vertigo. So the impact on their life is huge. And I want to get a sense of all the aspects of their whole case so that I can make their treatment plan customized and personalized for what they need.
As a side note, let's say you're at your job, right? So if you were prone to dizziness or vertigo, are there best practices, putting my chamber hat on, best practices that you would recommend for an employee? Do you get up and walk around? Do you have to have your computer screen a certain distance? I mean, are there things like that, or obviously it's probably a case-by-case basis?
Yeah, so that's a great question. I would say that there are certain best practices that apply to everybody. For example, proper ergonomics at your desk, as you mentioned. So making sure that your monitor is set up well, that your keyboard is set up well, that you have a good office chair. All those things are good in terms of preventing dizziness, preventing vertigo, making sure you have good glasses if you need them, and wearing your glasses. It's not enough just to have the glasses, you gotta wear the glasses. Making sure that prescription is up to date, because sometimes if people have outdated glasses or they're not wearing their glasses, that can cause dizziness when they're working on their computer over time. There's something that one of the eye doctors I work with very closely tells her patients, which is what she calls the 20-20-20 rule. So it's every 20 minutes, look 20 feet away from your monitor for 20 seconds. And that can help relieve dizziness for people that have eye strain or headaches after they work on the computer for a long time, because that can be a root cause of dizziness for some people. And then I would say managing your stress is really important. Stress can cause dizziness and vertigo. Staying hydrated is really important. They have found that if people have low vitamin D, supplementing vitamin D, if it's low or deficient, can help. But really most vertigo is spontaneous with no known cause. So to some extent, it's not preventable. The main thing is to know how to respond if you do get vertigo. One of the first things you can do is touch something solid. So like, you know how softly people can slide their hand across a page to read Braille? So like that soft touch of reading Braille, that's as much pressure as you would need under your hand to stabilize yourself.
Really?
Yes. So if one of the first things I teach my patients, if they have a vertigo attack and they're out and about, touch something solid. Just touch something solid and stable with one of your hands, and that allows your body to triangulate your balance. So you've got your one foot, your other foot, and now your hand is touching something. You have 3 points of contact on a solid surface, and your body can use a strategy called triangulation to help stabilize you. To say, oh no, I'm actually not moving. I'm actually stable and I'm okay. And so triangulation with your hand touching a solid surface is a great strategy. And then you want to try to talk yourself out of it. Like focus your eyes on something stable as well. So either a vertical line or a solid point, and just stare at that with your eyes, and then breathe and go, okay, I'm not moving. This is an illusion, right? I'm okay. I see my eyes are stable. My body's touching something solid. And then just try to stay calm, because most of the time it'll pass. I mean, there are some cases, as I mentioned, where people can have continuous, spontaneous vertigo. And if that's the case, usually you probably need to go to the emergency room and get checked out. But most of the time, the vertigo will pass within a minute, 5 minutes. And like what I teach my patients is, say you're out in public, for example, if you're at the grocery store, hold on to the cart, right? There's your solid touch points. If you're out and about in a public area, find a place to sit down and hold on to the armrests, right? And stare at something stable. Don't move your head and just try to breathe, calm down, and talk yourself out of it. You know, tell yourself, I'm not moving, I'm okay. Because what happens is people start to have a panic attack, and that actually escalates the dizziness.
I imagine.
And then it lasts for longer than it really needs to.
All really good tips. We talked a little bit about how you've treated a 5-year-old all the way up to a 100-year-old with the aging population and balance being an issue anyway. Do you find that a lot of your, or I should say, have you been going to some of the senior communities and working with that community?
Yes. So as I mentioned, I started doing this for the first 5 years of specializing in this type of physical therapy. I was working exclusively with people over 65 that were homebound. When I started my practice, I switched to be all ages. So now I work with anyone of any age as long as they have dizziness or vertigo. That's the criteria to become my patient.
But I figure you're sought after for workshops or seminars, I imagine, right?
Yes, exactly. So I've been, I was the co-chair of the San Diego County Fall Prevention Task Force for a total of 8 years. And I've been basically the clinical leader of that task force since probably about 2006. So about 18 years, of which 8 of those years I served as the co-chair. And in that role, I've probably gone out into the San Diego community and talked at senior centers, different support groups, different assisted livings, et cetera, probably at least 100 times. And when I stepped down from my role as the co-chair, in order to fill that space and I wanted to make a team of people that could go out in the community and provide this education because it is so important. And so we now have launched something called the Speakers Bureau. So we have actually a Speakers Bureau that's hosted by San Diego County of people that we've trained with the evidence-based knowledge on how to prevent falling and things like that are trained to go out into the community and do talks. But just probably 2 weeks ago, I was out at the Rotary Club in La Jolla. They invited me to do a talk on preventing falling, and of course I talked about dizziness because it's so huge in older people. And I just did a talk actually at an older adult community off of South Willow Spring in Encinitas as well. Yeah.
All right.
So I do a lot of talks out in the community, just you know, in order to help people. At least to give them an idea that maybe they don't have to live like this.
And they're not alone.
Exactly. And what to do, you know.
Someone's advocating for them.
Yes.
All right, so you have with all that you're doing, 2 things I want to get to. One is you have a trademark Bell method.
Yes.
Can you explain a little bit of what that is?
Yes. So my profession, my license is a physical therapist. My specialty within physical therapy is called vestibular physical therapy. That's inner ear physical therapy. And so that's what I'm an expert in doing. But yet, there are people who have dizziness from their neck, for example. So people with an old whiplash injury, if they got in an accident, they got rear-ended 15 or 20 years ago, and then 15 or 20 years later, they start having vertigo attacks. They're not thinking about their old whiplash injury because it isn't current in their mind, but yet sometimes that is actually the root cause of vertigo attacks that can last for hours. And I've had a handful of people recently from my church that had that same exact story. And so that's an example of their past neck trauma causing current day vertigo attacks. People can have problems with their vision. We talked about that briefly about the computer. So there can be eye problems or visual triggers. People can have a neurological tendency towards migraines, for example. Especially now with the COVID pandemic having come through, we're seeing a lot more people with viral vertigo. So they're getting chronic waxing and waning viruses, especially in the people with the long COVID presentation. That's a cause of vertigo. And so there are other causes of vertigo besides the inner ear that I think need to be evaluated when I work with a new patient, right? So I'm checking them. That's why the initial consultation with me takes like 5 hours, because I'm checking all these things, right? Is it your blood pressure? Is it your heart rate? Is it your oxygen? Is it your endocrine system? Is it your visual system? Is it your neurological system? Are you getting headaches, migraines? Do you have TMJ? Did you get in a car accident 20 years ago? Is there something wrong with your neck, right? I mean, just there's so many things to check. Even interestingly, and this is how the Bell method evolved. People with bladder problems, right? So think about that for a second. What do bladder problems have to do with dizziness? Well, I'll tell you. When people have a problem with their bladder leaking, they don't drink enough water on purpose to avoid having an accident. And then they get dehydrated, and that can cause dizziness. But then when they stand up quickly, their blood pressure drops because they're dehydrated, and then they have dizziness with standing. Okay, so then dial that all the way back. Part of my Bell method, in that case, I train them with bladder control retraining exercises. So I'm going to give them exercises to strengthen their bladder because the bladder is controlled by muscles and it can be strengthened just like other muscles. And then once we get their bladder control improved, then we also increase the amount of water they're drinking and then their dizziness is gone. Okay?
Never would have connected that.
Never would have connected it. But that's the example of the Bell method. So I put that whole thing together because of all the people I've worked with. I know that inner ear physical therapy is important. So vestibular physical therapy is important. And that's what I do for most patients for follow-up care, is that type of rehab. But in the big picture, there's a lot of other problems that cause dizziness and vertigo beyond that. And so I've put together my method that includes all these different body parts and body systems that all interplay with each other like a domino effect and cascade into the dizziness problem. And so when we back all that up, okay, their blood pressure was dropping because they were dehydrated, and that was because they're incontinent, and so let's train the bladder, right? And so that's part of why my method is different than, say, another vestibular physical therapist you might find that's only doing that kind of intervention and only looking at that kind of problem with patients. Another example is foot neuropathy. So, you know, people with numbness in their feet, okay? A lot of times it's from diabetes, but it can be from no known cause, just you can't feel your feet. And so people with neuropathy in their feet may get dizzy when they stand up or feel disequilibrium during standing because they can't feel their feet, or they don't have, maybe in some cases, good circulation in their feet. So I developed a set of exercises with a colleague of mine called the bean box exercises, where we literally get a banker's box with 10 pounds of pinto beans, and we put the bare feet in there, and then they do a set of 5 exercises for 10 minutes a day. And I've had patients reverse their neuropathy with these exercises, and then they're not dizzy when they stand up, and they don't feel off balance, and then they can walk confidently on cobblestones and grass and sand and things that may have previously caused them to feel really off. So it's not everyone can reverse their neuropathy with exercises, but some people have had success with that. And so that's another example where that doesn't really fall underneath traditional vestibular physical therapy, which is really focused on the crystals and the inner ear exercises. So that's why the Bell method is unique. Because I'm more looking at the whole person.
Got it. Well, you're living up to your Vertigo Detective name for sure.
There you go.
All right, and now you have another title that you can add to Kim Bell, and that's author.
Yes.
So you recently published a book.
I did.
And I'm going to read it here. It's the Navigating the Healthcare System as a Dizzy Patient, right here.
Yes.
So what precipitated you writing a book?
Yes. So what precipitated this was, as you asked me about before, talks out in the community. I've done 3 talks at the Stein Center at UCSD. So they're called public lectures at the Stein Center, and on different topics related to dizziness, vertigo, and preventing falls. The audience there is people over 50. And so my talk that I did there in 2017 on dizziness and vertigo, research on aging, part 1 is what it's called. It's gotten over 3 million views worldwide on University of California television and on YouTube. And so probably about 5 years ago, I started receiving regular inquiries from people all over the world. Needing help for vertigo because they had seen that lecture online and they were reaching out to me at the end of their rope looking for help, right? But because I'm a licensed healthcare provider and I'm only licensed in the state of California, I can't help people that are outside of California. It's just the law. So my attorney actually advised me to write a book to help them. She said, if you really want to help these people, write a book, and that way you can provide them with the information you think they need to advocate for themselves and skillfully navigate the healthcare system wherever they live, that they have the vocabulary, they have the understanding, they're walking into their doctor's appointments prepared, and they know what to say, and they know what to ask, and they know where the pitfalls are. in the healthcare system where they can fall into a trap or not get the results they're looking for. And so that's where the book came from. So it's 12 chapters. It's for patients that can't work with me in person for whatever reason. Maybe locally, that would be someone that can't pay out of pocket for private physical therapy, or somebody that can't travel here. I do get a lot of people traveling to Encinitas from all over the US and many foreign countries to work with me, but some people can't travel because it's expensive, or they just can't travel because they're too dizzy, right? So it would be for those folks, and then anyone really that is looking for help through accessing healthcare for dizziness or vertigo. That's who it's for.
Wow. Kim Bell right in your back pocket there. So did you enjoy the process of writing?
I love writing. I did enjoy the process of writing. Here's what I learned. It took me 3 years to finish the book. I love writing. I don't love editing.
There you go. Okay.
It was very painful. It was very painful to edit, to have someone really kind of pulling apart your work and pointing out, things and having to go through it again and again and again. So editing was a little bit painful, I'm not going to lie. But I do love writing and actually continue to write. So I have 2 blog sites that I publish 1 blog per month.
Okay.
One is my website called vertigodetective.com. That's one blog site. And then my other blog site is called betterbalanceinlife.com. So on both of those sites, I publish 1 blog per month. And I think total I have well over 200 blogs. So I'm always writing. Most of my writing is actually inspired by my patients and by their stories, by maybe what they've been told before they met me, or what we've learned and studied together, because I'm always learning,
Well, right, and the more, those patient stories is going to help someone down the road.
That's right. Someone that has that same problem.
They can make that connection.
Right, exactly. And they're looking online, researching that specific topic. So I try to make YouTube videos and write blogs that speak to certain topics. And they're going to be in the more digestible, bite-sized bits, whereas the book is more like the entree. It's like a 5-course meal there. It's a pretty lengthy book, but it's not very technical. I don't cite a ton of sources. It's not a textbook by any means. It's written for people like my mom or my sister or your mom or your sister, right? Who are just looking for help, and they're coming from, I don't know anything about this, and now I need to figure it out so I can get the help I need when the healthcare system is dropping the ball on a lot of these folks with dizziness or vertigo. They're getting all the tests, they're not finding anything, and they're just getting told, sorry, we don't know what to tell you. Just take this medication for the rest of your life. But the medications all have side effects. And so that's not desirable for most people.
Right.
Yep.
All right, I think that's a great place to end. Just talking about bite size. This is a podcast, so it's bite size, but really to delve a little bit deeper, go and purchase your book. And there's a wealth of information that I've learned today, so I appreciate your time. Any parting words that you want to share with the audience?
I would just say, don't give up hope. A lot of times the key thing is figuring out the root cause of the dizziness or vertigo, which most patients that I work with don't know the root cause. They don't have a proper diagnosis, and so they're left confused. They feel hopeless, frustrated, maybe depressed, anxious, all of those things. So I would say just don't give up hope, but recognize the reality of the situation is that many dizzy patients fall through the cracks of the healthcare system. It's not set up well for people with dizziness or vertigo, unfortunately. And so you have to become your own advocate. And so that's what my book is for, is to help people that are ready to advocate for themselves, to skillfully navigate the healthcare system, to find answers, and to get relief.
And where, if I want to pick this up, where can I get it?
Yeah, so it's available at 200,000 bookstores worldwide, but most people just buy it on Amazon, right? So go to Amazon, Barnes & Nobles, anything like that. There's a paperback version, a hardback version, and an ebook.
Oh, an ebook too. That's great. All right, and one more time, your website where people can find out more information locally in California?
Vertigodetective.com.
Thank you so much.
My pleasure. Thanks for having me.